you will observe that more and more contact trace cases are becoming positive. Then another issue is more symptomatic cases are reporting. So those are certain issues we are also trying to address. Apart from that, we have seen it during that month of October. Number of mortality also has increased. So this, keeping all this in mind, from the department side, from the health department side, we were trying our best. One thing, if we look at all these issues, then following the unlock, people think that pandemic is over. So complacency starts setting in. Apart from all this observation, another observation which we have seen is people are reporting to the hospital very late, to the health units very late. When they come to the hospital at the later stage, when they are totally gone into the difficulty in breathing or some kind of serious complaints. That's why probably the morbidity and also mortality has increased. People are resisting to come for testing, reluctant to come for testing. Contact traced, call them, people are refusing to come. So this will add into more complications if it is positive. So our message to the people is early testing is the most important thing. Then the other issues which we are more worried is now winter has set in, flu season has started. So with flu infection along with COVID infection can lead to even more serious complications, can become more serious.
It is a collective social responsibility. It will work better and more effective when every citizen observe this three things. So that is why with this wearing of masks like that, WHO studies have shown that 85% of the transmission can be this. Here you can see, this is from the life science.
That doesn't mean that they are not exposed to the reinfection. Now, once a person recovers from COVID-19, he thinks that this is not a problem from him anymore, but not knowing that he can be reinfected. So now the thing is that these people don't go for testing again, and most of the COVID-19 disease, those who get the reinfections are mostly asymptomatic.
No one in the world has gone through a COVID winter. Now the COVID winter is upon us. We are entering the winter season. Nowhere in the world, no one has gone through a winter with COVID. So there are lots of speculations. And as how our PD has mentioned, with winter comes the flu season. And with the winter comes also the cold, so people will huddle together, people will stay close together so that, to keep warmth.